Today's lecture will be on the urinary system. Some important functions of the urinary system is it's a storage unit for urine. We see that in the urinary tract, in particular the urinary bladder. It can store up to 1 liter of water in the urinary bladder. The process of excretion of urine, usually after it's stored in the urinary bladder, it travels out through the urethra. This process is called micturition or urination. It also regulates blood volume indirectly. It regulates blood pressure volume. We'll see that in the organ of the kidney. Also inside of the kidney, it has the ability to regulate erythrocyte production, particularly releasing a hormone called erythropoietin, which stimulates red bone marrow that will then allow for the release of red blood cells or erythrocytes. The kidney's job also is to regulate ion levels, particularly controlling blood level ions of sodium, potassium, calcium, phosphate, through the process of elimination from the blood. It also regulates acid base balance through positive hydrogen ions and negative bicarbonate ions. So the first thing we'll look at is just the general position of the kidney. The left one sits slightly more superior than the right kidney. The right kidney is about 2 centimeters more inferior to accommodate the position of the liver, which is in the left side of the abdominal pelvic cavity. So when we look at the left kidney, we can see that the superior pole is basically at the level of T12 vertebrae, and the inferior pole is at the level of L3 vertebrae. After the solutes are pulled out of the kidney, it'll travel through the urinary tract, which makes up the ureter, storage in the urinary bladder, and then usually with excretion through the urethra. So when we're just looking at a coronal section of the kidney, some particular parts that we should become more familiar with is first the renal cortex. With the renal cortex, it's the outer surface. With the renal cortex, we go all the way around, and lining the renal cortex, we'll have this fibrous capsule. With the fibrous capsule, what we see is then we are going to see a series of layers, so I drew it out in different colors. So going from deep to superficial, the deepest layer would be the fibrous capsule. The second layer, the blue layer, would be the perinephric, P-E-R-I, nephric fat. And then the green layer would be the renal fascia. And then the orange layer would be the paranephric fat, P-A-R-A. So we have a fibrous outer capsule, perinephric fat, the renal fascia, the green, and then the paranephric fat, the orange. So this would be on the external surface. So going more deep into the organ, we see the renal cortex, and then we have the renal medulla. And with the renal cortex, we see an extension of the renal cortex called renal column. And this renal column is just an extension of the renal cortex, and it helps subdivide each of the renal medulla into what we call a renal pyramid. So an adult usually has anywhere from 8 to 15 divisions or renal pyramids. Inside each one of these renal pyramids, we're going to see these renal sinuses. And basically, a renal sinus is the makeup of a minor calyx, which from the collecting tubules, we'll see urine go from the collecting tubules to the minor calyx, eventually into the major calyx, into the renal pelvis, and this is where we see all the renal or major calyxes. So here, here, and here, they all are going to merge inside of the renal pelvis. And then Urine is collected in the renal pelvis and then traveling out through the ureter to the urinary bladder and eventually through excretion with the urethra. So when we're looking at the blood flow, we see the hilum of the kidney. Here is the renal pelvis, the collecting duct for urine, and then here's the ureter. But we'll see that blood flow will be coming into, and about 20 to 25% of the blood is going to flow through the kidneys. So we'll see oxygen-rich blood entering into the renal artery, eventually traveling into smaller vessels called the segmental artery, and then going into the interlobar arteries, and then finally we see it entering into the medulla cortex, where we see it travel into a smaller vessel called an arcuate artery, and then back into another smaller vessel called an interlobar artery. And then once we get into the interlobar artery, so this picture is showing the transition of the interlobar artery from the medulla to the cortex, we come into the beginnings of an afferent arteriole. So the afferent arteriole is going to enter into a capillary network called a glomerulus. And the glomerulus is important because this is where we see in this section here, we're going to see blood plasma filtered through the fenestrated epithelial into the outer shell of the glomerulus, which is called the renal corpuscle. This plasma and solute is going to then go filter through the nephron loop. And then once the blood has been filtered with particular plasma and ions being pulled out, then the remaining blood is going to leave the glomerulus and enter back through the efferent arteriole, and it's going to then go back into circulation. So when we see the efferent arteriole, we're going to see two different types of capillary networks responsible for exchanging gas and nutrients. One is going to be the paratubular capillaries, which is associated with the convoluted tubules. And the convoluted tubules are located more in the renal cortex. And the vasa recta, these capillary networks are going to be more associated with the nephron loop, which is located inside of the medulla. After the filtrate has been pulled out, then we see the deoxygenated blood, or the remaining blood, going into the interlobar vein, out through the arcuate vein, through the interlobar vein, and eventually out the renal vein. So this is a picture of the ureter. So here we have the right kidney, and we've just done a cross-sectional area of the ureter. And it's a fibromuscular muscular tube. It conducts urine from the kidney to the urinary bladder. It originates higher up inside of the renal pelvis as it exits the medial surface of the kidney, or what we call the hilum, and eventually is going to travel into the urinary bladder. So it has three tunics, or three distinct layers: the mucosa, muscularis, and the adventia. The mucosa, the innermost layer, couple key points, is that it is a transitional epithelial tissue. So here we can see in the slide, it has transitional epithelial. It also has a series of folds. These folding of the mucosa allows for the stretching to occur and through increase the lumen size and to allow for more urine to transfer into the urinary bladder. When we look at the importance, it's mainly for distendability or stretching, and it's also very impermeable. And then on the mucosa, we also have the lamina propria. It's made of dense irregular connective tissue. Moving one further out, moving more superficial, we have the muscularis layer. It's also considered to be a smooth muscle layer. It has an inner and outer longitudinal layer. So over here we can see another histology of the ureter. We have an inner longitudinal layer and an outer circular layer. Their job is to produce peristaltic waves. Peristaltic waves will allow for the urine to transition into the urinary bladder. And then finally, the most outer covering is the adventia. So we can see it here on the cross-sectional area or over here in the histology slide. And it's made up of areolar connective tissue. So the nervous system is connected through the sympathetic axons from your T11 through L2 segments, and their job is to detect pain. So this is an important area when we see the sympathetic axons innervation to detect pain in instances such as a kidney stone that may have become lodged, that left the kidney and was lodged inside of the ureter. The sympathetic axons will recognize that pain and send a signal to the brain. So as we're traveling down the ureter, we can see the right ureter, which is coming from the right kidney, and the left ureter, which is coming from the left kidney, forms into the reservoir for urine collection, which is called the urinary bladder. It has this median umbilical ligament here, and the medial umbilical ligament is actually a remnant of an embryological structure called a urachus. So this used to be an old structure when you were in vitro. And then on the posterior, we see the ureters entering into the posterior lateral walls of the urinary bladder here. And then deep inside, what we see is a series of rugae. And these rugae are folds, which basically very similar to the lumen of the ureter. It gives the ability for the urinary bladder to stretch. This structure right here, called a trigone, it's on the posterior surface or inner surface of the ureter or the urinary bladder. The trigone, it does not move, so this area does not distend when the urinary bladder is being full, but it serves as a funnel, so to speak, to funnel urine into the urethra for excretion. So when we're looking at the overall histology slide over here, what we see is that this urinary bladder has three tunics. It has the mucosa. It also has a submucosa. It actually has a muscularis layer, and then again an adventia layer, which is the most superficial. So starting with the mucosa, this is going to line the inner, it lines the bladder lumen. It's made out of transitional epithelial. It accommodates the distension. So we can see here this transitional epithelial, and the rugae or the internal folds can allow for distension. It also houses the lamina propria, so this thin lining here. This is a very highly vascularized area. And as mentioned before, it also has the rugae, which is here. These rugae are mucosal folds that also accommodate different types of distension. On the muscularis layer, in particularly, what we see is that it's called a detrusor muscle. And a detrusor muscle, we have two actually. With the detrusor muscle, their job is, with the innervation, is it's a smooth muscle. There's three layers of smooth muscle called the detrusor. And then it also has an internal urethral sphincter here. So this is the most inferior portion of the detrusor muscle. And this has an involuntary smooth muscle to it. And then finally, the adventia. The adventia is an areolar connective tissue. And then when we're looking at how bladder is released, we would see that urine production occurs in the kidney, travels down through the ureter from the left and the right kidney. It's going to fill the urinary bladder. And the urinary bladder has a micturition reflex or urination reflex. Basically, when the bladder fills, the parasympathetic axons from the micturition reflex centers in the spinal segments of your sacral 2 and S4, it relaxes in particularly the internal urethral sphincter. So once the parasympathetic axons are triggered, it's going to have a direct effect on the internal urethral sphincter, which then allows for urine to pass. So once the urine passes through the internal urethral sphincter, it stimulates the contraction of all of the detrusor muscles located here, and that will then cause, instead of distension, it'll cause the urinary bladder to contract, which then will continue to empty out the urinary bladder. And finally, the last structure that we see is the urethra. The urethra would be the final passage of urine out, or excretion of urine. So here we have a picture of a female and a male urethra, and we can see that there's structural differences that occur. The main thing is that the female urethra, its main job is just for transportation of urine. When we look at the male urethra, it has urinary and reproduction functions. So the first part that we look at is both of these have is going to be the fact that we see the internal urethral sphincter, we see the external urethral sphincter, and then eventually the urethral orifice. When we're over on the other side, the external urethral sphincter, so this one right here on the female, this is a voluntary muscle. It's a skeletal muscle fiber of the urogenital diaphragm. So here you can see it. It's associated with the urogenital diaphragm. With the male side, we have a little bit of a different, we have three different, since it's part of the urinary and reproductive functions, it has 3 levels. So it has a prostatic urethra. This area is the most, this section right here is the most dilatable portion. It also is lined with transitional epithelial, so it has the ability to stretch and recoil. It has a membranous urethra, and this section is the least dilatable. It's made of stratified columnar or pseudostratified columnar epithelial. And then finally we have the spongy urethra. It's the longest part that's in the male urethra, and it extends eventually into the external urethral orifice. So that concludes the structural component of the urinary system.